There's an increase in the number of COVID-19 cases in India. The country has recorded around 1,134 new COVID-19 infections in the past 24 hours. In this episode of WION Conversation, we decode as to what is actually with the COVID-19 cases in India. Should you be worried, or is it just about how the cases are expected to fluctuate in the coming few months? To answer all these questions, we are now being joined by Dr. Vivek Nangia, Principal Director and Head Pulmonology at Max Super Hospital in New Delhi. Thank you so much for joining us, Doctor.
Thank you, Raisha, for having me on your show.
Right, I want to first start by asking you as to why is India witnessing a sudden spike in COVID-19 cases?
So this was kind of expected. We always knew that COVID is never going to leave us. It's there in our ecosystem and is going to come back sometime or the other. So I guess this is not something very unexpected or alarming, especially now when there are hardly any restrictions, travel has opened up fully, COVID is already happening in so many other countries as well, including US, UK. So people who are traveling back may be carrying the virus or maybe inherently. So that is something that we'll get to know in times to come once we're able to identify which strain it is right now that is prevailing and whether it matches with the strain abroad or not. But as of now, I guess we don't need to worry or panic about it because the illness is very mild and easily manageable at home only. There are hardly any hospitalizations happening or anybody developing a moderate to severe kind of an illness yet.
Right, Doctor. But do you think that the COVID-19 cases are increasing due to the rise in the H3N2 virus? In your assessment, do you think is there any correlation between the H3N2 virus and the COVID-19 virus?
See, basically, both the viruses are respiratory viruses. Both of them spread through respiratory secretions and both of them impact the lungs as predominant organs. So as far as coexistence of the two is concerned, it's difficult to say if there's any relationship per se between them. But yes, it can certainly happen that if the immunity is low because of one virus, then the second viral infection can also happen if there has been an exposure.
And India has also been witnessing an uptick in COVID-19 cases since March 2023. Why is that?
So I guess maybe because of these changes in season, fluctuations in the weather conditions these days, suddenly from warm it has become cold again. And also because of travel that has opened up, a lot of traveling happening these days, people are carrying the virus. And also maybe earlier we were not testing as much. And now because of H3N2, we have started testing our patients also. So that could also be a reason actually.
Right, and like
let's not forget that by now, the immunity of the vaccination also may be waning off gradually in many people.
Right, like you mentioned that people are traveling and they're not really worried about the COVID-19 virus which is spreading currently. But the centre has already issued an alarm with the spike in COVID-19 cases. It has now issued revised guidelines. But the bigger question being right now is that have people become complacent when taking precautions against the virus?
Absolutely. Now we don't see anybody wearing masks or following any social distancing. There are usual parties happening, gatherings happening, conferences happening, meetings happening, closed doors. So I think we've somewhere forgotten about the devastating effect that COVID can have on our lives, on our health. I think we need to be cautious all over again and follow all those precautions again, even if it not only provides you protection against COVID, but it also provides you protection against any other respiratory viral infection and respiratory bacterial infections too. So I think it is worthwhile following all those precautions. Those are something that we should actually imbibe them as our day-to-day routine and follow them on regularly.
Right, Doctor. What would your advice be to our viewers to combat the surge in COVID-19 infections at the moment?
So I think the first and foremost is that if anybody develops symptoms suggestive of any kind of a viral illness, like cough, cold, fever, body aches, sore throats, first thing would be to get yourself tested and isolate yourself. Isolation is very, very important to prevent the spread of this illness to others, especially your own near and dear ones and your colleagues and your friends. So what is important is that isolate yourself, get yourself tested. If it is COVID, then take the proper treatment. If it is H3N2, H1N1, anything else, then a second line of treatment can also be followed for these patients.
Right, Doctor. Now, in the last 24 hours, just to bring out the numbers, there have been over 1,000 new COVID-19 cases. New Delhi, meanwhile, has recorded over 270 cases. I want to seek your assessment that do you see that the numbers increasing in the next couple of weeks in the Indian national capital?
Well, it looks like the way the numbers are increasing in the next, I mean, the numbers have increased over the last couple of days only. The spike has started coming only in the
Right.
last 2-3 days that we're saying. It seems so that the numbers are likely to rise further in the next week or two.
And how prepared are the hospitals in New Delhi to deal with the surge both in the COVID-19 cases and the H3N2 influenza virus?
So, well, luckily, as I said, we are only getting very mild illnesses. In COVID-19, most people, they're experiencing fever only for about 1 or 2 days, not longer than that. There are hardly any hospitalizations happening because of COVID. And if need be, I think just like the last time and the time prior to that, our hospitals are fully geared up to handle any kind of crisis situation. In fact, we are better geared up than most other countries of the world.
Right, absolutely. Can you also draw a comparison between the symptoms of COVID-19 and that of H3N2 virus?
Well, the symptoms of the two are very, very similar. Most of these patients would have a cough, cold, sore throat, high-grade fever, body aches. Some of them may even have vomitings, nausea, and loose motion. So a small proportion have gastric symptoms, but predominantly, again, it's the respiratory tract symptoms only, along with fever, body aches, and sweating.
Right. My last question to you before I let you go, Doctor. Do you think that people will comply with the latest state guidelines that have come out?
Yeah, certainly. I think, if you get the guidelines timely, then there's no reason why one should not comply with them really.
Right. Thank you so much for sharing your insights with us, Doctor, and joining us in WION at this hour. Thanks very much.
Thank you so much for having me on your show. Thank you.